Hello, this is Dr. Sukalyan Purkayastha, and I'm a neurointerventionist, and today I'll be talking about the treatment of benign intracranial hypertension. So this is a very interesting entity. In most of the cases it remains undiagnosed. Usually the young females who are a bit obese, who are affected by this disease entity, and they present with vomiting, visual disturbance, and when we go for an MR scan, we see the prominence of the CSF space around the optic nerve, and there is tortuosity or kinking of the optic nerve. And when we see the veins, probably there is a stenosis in the veins of the brain, and that's how the disease arises. So many patients go to the ophthalmologist, and when they see the ophthalmological parameters, they see a decrease in the visual acuity in these patients, and then they send the patient to us for further treatment. So what we do an angiogram and take the venous pressure gradient across the stenosis in the veins. And then what we do is we try to open the veins by doing a venous angioplasty, that is by opening with a balloon. Here is an example. As you can see that there is a narrowing in the junction of the transverse and the sigmoid sinus of the brain, and on both sides, and we are putting a balloon and opening the vein. And this is how the situation looks like after angioplasty. There is complete resolution of this ophthalmic problem. The patient's sight has drastically improved, and this is the follow-up DSA of these patients. The veins look absolutely normal. Here is another example where in more severe cases where the simple angioplasty may not help, and we sometimes try and put stent across the nerving, which keeps the vein open permanently, and the patient recovers immediately from this disease entity. So the important thing is that if you don't treat them immediately, they might lose vision, and which is a permanent, which can be a permanent visual failure for the patient. So again, firstly the patient may be tried with medicines, but if the patient is losing vision very rapidly, or the patient is having intractable headache, vomiting, then we should not lose time, and we should immediately assess the patient with DSA. And also sometimes we see the CSF pressure by doing a lumbar puncture, see the CSF opening pressure, and accordingly we take a call how the patient should be treated. So this is a very important disease entity, which in many cases I have seen they remain undiagnosed and the patient loses their vision. So all of you should know about this entity, and we should not waste any time for treating this disease. Thank you very much.